topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, New York. Welcome to another Ask the Expert show where for the last 17 years we have brought you the top experts in the field of legal, health, financial, and home improvement. Hey, if you are getting ready to go into Medicare, you are in Medicare, we have one of the top agents in the New York State area with Dan Alcorn with Alcorn & Associates. It's going to be a great show. There's so many things going on in Medicare. We want to welcome our new viewers, our TikTok viewers, to the Ask the Expert show. If you have a question about Medicare, please text us in. We'll be sure to ask. And let's say good morning to Dan Alcorn and staff.
Good morning, Steve, and thanks so much for having us. I want to also introduce my colleagues, Mr. Chris Amorosi and Kate Barkley. All of us are based up here in upstate New York.
Well, Kate, I don't think, has Kate ever been on our show before?
No.
This is my first appearance. I'm very excited.
Oh, okay. I recognize Chris. Hey, I got to tell you, first of all, with all these new viewers on TikTok, Dan, tell people about your organization.
So we are a group of licensed independent agents focusing on Medicare plans, that is Medicare Supplement, Part D prescription drugs, Medicare Advantage plans. We three here are based and licensed in New York. However, we service clients in other states, New Hampshire, Massachusetts, New Jersey, and your home state of Florida, Chris. Important, we are independent. We are not employees of any insurance company. We are representing those insurance companies that we find would be a good fit for our clients' providers and medications and upcoming healthcare needs.
I tell you what, there is so much going on when it comes to Medicare. I want to compliment you on one of the areas because people see these national ads, make a lot of promises, Dan, and sometimes even if they're true, it might not hold for your part of the state or your county or your zip code. And I got to tell you, the whole purpose of the show, besides educating you on Medicare, is how important it is to have an agent. Because when you call these companies, Dan, I know you know this, when you call these companies, they're just going to tell you about their company only, whereas you represent many companies and you can show a client many new platforms when it comes to choosing a Medicare plan.
That's correct. Yeah. Absolutely. Kate, want to take that and run with that? Because you've got a number of clients
Absolutely.
in the North Country. Sure, go ahead.
Yeah. No, it's very, very important to know that you're not speaking to this disenfranchised voice over the phone. There are many, many choices, and there's no such thing as, oh, just give me the best plan. The best plan is very, very person-centered and individual. So you really have to have the ability to do a deep dive into people's medicines, their preferred pharmacy, their exact doctors, and be able to show all of the choices and look at them apples to apples.
I got to tell you, I don't know if I shared this with you before. I do a lot of different types of due diligence because I want to make sure we have the best of the best. And I called a major company, and actually, I called them 3 different times, and I got 3 different quotes. That's why it's so important to have a great agent like Alcorn and Associates. I was blown away. The same company, 3 different agents gave me 3 different quotes. And I got to tell you, the demographics that you deal with, it's a little older demographic, and they don't quite understand everything about Medicare. And there's so much out there.
Well, that's true, Steve. Let's say, for example, we represent maybe 7 or 8 different carriers just in one market. Now, our colleague Alicia, who's been on our show earlier, she's in Long Island, New York market, and Kate is almost at the opposite end of the state. They may represent different carriers because of what's available in their community. But even within that one carrier, that one insurance company, they may have 5 or 6 different offerings just within the company. So when you're talking to, or, as you say, you called a company and got multiple quotes, it's quite possible that there may have been multiple plans, but not taking the time with you, as Kate pointed out, to individually walk you through the various plans that are available in that one company. Healthcare is so personal and so local. And so that's why, someone like Kate, Chris, or Alicia, who are on top of what's going on in their local community and can find a plan that works for you. And oh, by the way, to add on what Kate said, you could have a spouse in a completely different health plan because their individual needs are different as well. You don't have to be on the same plan.
And the other monkey in the wrench too, and I think you guys can agree with this, is the ever changing world of Medicare from day to day. I mean, I know myself, I find myself sitting at the table with a client and I'm questioning, did that rule change, or is that still in effect? And Dan, I've called you right from home appointments and said, am I on the right track here? And so that's the other thing too, is that we as agents have each other to bounce off questions and which only helps our clients.
Yeah, we are a team. Absolutely. Good point, Chris. We help each other out because, as that other insurance company says, we know a thing or two because we've seen a thing or two, but sometimes it's, keeping track of all of these moving rules, as Chris pointed out. So
yes, it's very much like putting a puzzle together. Yeah.
Hey, the other day, the president came out and said, starting July 1st, if you're on Medicare, I call it the skinny injection, the Ozempic, those companies, that if you're on Medicare, you're now going to be able to get these skinny injections for $50 a month. Do you know anything about that?
I'll take it. That's the GLP.
Yes.
Yes, we're quite aware of it. It's those medications. It's GLP-1. Did I get that right? Yes. Those medications are currently in with Medicare Part D, the drug plans. Historically, they've been used for treating, clinical conditions. I don't want to get too much into the weeds. But the growth in the prescriptions in those has been staggering and overwhelmingly affecting the Part D plan costs. So we're seeing that show up in the premiums and the drug deductibles and in other ways that cost is being available to consumers at a lower premium, a lower cost sharing, and the cost on that is being absorbed increasingly by the health plans. And so in 2025 and in 2026, we saw that reveal itself in higher premiums, higher drug deductibles, different cost shifting going around. So yes, all of these public policy announcements, whether it's reducing the cost of insulin or capping the cost of drugs, which is $2,100 per year, I say it's like squeezing a balloon. It's going to show up somewhere else. So yeah, these GLP-1 drugs are quite popular, and it's shifting costs. We'll see this summer and announced in September and October what those cost shiftings will look like for plans in 2027. We're waiting on pins and needles. That fair to say, Kate, Chris?
Yeah, and I just
Absolutely.
read, I don't know, I just read somewhere because I was just doing some deep dive stuff. I don't know if you guys heard this, but for 2027, the out-of-pocket max for Part D is going up to 2,400, I think.
I hadn't read that. Yeah. Well, it
From
went from
20,
2,000 to 2,100 this year.
and then I was reading because of the CMS announcement. I
Right.
think I read that, so maybe going up to 2,400. So
Yeah.
Well, thankfully, due to the Inflation Reduction Act, we no longer have that donut hole. We no
right.
longer have that very large max out of pocket. I'm very grateful to see that as the years have have gone by, in my experience, at least it is capped. No more donut hole.
Right, and that's a great segue to Steve, to your question about this Trump RX and Mark Cuban's prescription.
Yes.
We know, and let's just for the sake of argument right now say it's going up in 2027 to $2,400, that out-of-pocket max. Don't know if Trump's prescription or Mark Cuban or Amazon, if they have a max out of pocket. So that's what you have to take into consideration when people say, oh, it's going to be cheaper, but you're going to be spending more at the end of the year of 2,400, or you know what I'm saying? So that's another thing that we need to educate ourselves on.
And we increasingly find ourselves saying to our clients, at the end of all of this, it really now becomes Medicare math. So many of these plans have commoditized, meaning that they're very similar in many regards, for co-pays or hospital stays or what have you. There's differences, but they're not a significant difference. But when you're looking at premiums, maximum out of pockets, to Chris's point, the drug D plans do have a maximum out of pocket, as Kate pointed out, due to the IRA. These alternatives have no protection of that 2,000, 2,100 to 2,400. At some point, you got to sit down with our clients and we just do the math.
When you put that puzzle together, it's always the math that allows you to make an informed decision.
Exactly right.
Hey, I want to get this question in from TikTok. I just found your show. I don't know how long it's been running for. Thank God there is a show about Medicare out there. I do live in the New York area. I'm so confused. I will be calling your office. What is the difference between regular Medicare versus this Medicare Advantage?
Chris, want to run with that one?
Sure. Well, Medicare Advantage plans, here's how I used to explain it, is you have Part A, you have Part B, and I always explain it as Part A plus Part B plus Part D equals Part C, which is your Medicare Advantage plans. So with straight Medicare, if you just have Medicare Parts A and B, you have deductibles. And on top of that, you would have to purchase an individual prescription plan to couple with just your Medicare Part A and B. One of the advantages of the Medicare Advantage plan is you have everything under one umbrella, and you know what your out-of-pocket costs are going to be. When you go see a specialist, it's a $35 copay. If you go to outpatient surgery, it's going to be a set amount. So you don't have to guess, where with Part A and Part B, with the deductibles and the 80% and the 20% and what the doctor accepts. It's more simplified with the Medicare Advantage plans. but it goes deeper than that. I mean, we could be here for an hour explaining the differences, but I
I
think
have quick little tricks to remembering these parts, okay? So original Medicare on your red, white, and blue card is parts A and B. With A, I think of the A as standing for admitted. It's what you're admitted to, hospital, hospice, rehab, okay? Part B is based in the community. It's not based in a hospital. And that original Medicare covers 80%. So when you look at part C, I think of the C as standing for carriers because there are so many carriers to choose from. And it includes, unless you get it somewhere else, your Part D drug. So, like Chris said, at the end of the day, when you have Part C, also known as an Advantage plan, you also have A, B, C, and D.
And to that, on to what they're saying, and I will then also say, but you want to keep in mind that those carriers are managing your Medicare Parts A and B benefits. These are private companies. Some are for profit, some are nonprofit. They are managing your Part A and B Medicare benefits and sometimes are more involved in that care decision. So that's what you've seen in the news lately, a little bit of controversy over what's called prior authorizations, whereas your carrier may need to be involved in approving a procedure before it's actually conducted. And so there's some tug of war going on between the providers and the carriers on these managed care Part C plans. There's no right or wrong. We just want to make sure that our clients understand the nuances between the two and then come in and settle in on something that fits their providers, their medications, their upcoming health plans, and their finances, because they can be quite expensive one way or the other. We go back to what Kate said. It's the math.
Hey, guys, I got to tell you this. I just got a text from one of our employees here. They got a phone call from another agent in the New York area just to tell us that our panel is really good and they're really giving out some good information. I have never in 17 years had someone call in during the show and compliment our panel, which is amazing. I want to get
Steve, really, we look at this as a consultancy role. We don't sell anything. We are, in some sense, educators, consultants, sitting down with individuals in their community and walking them through what's available. We need to point out, we don't represent every company. We represent that we vet and believe will best meet our clients' needs. There are companies out there that we choose not to represent. And that's because we know what's going on in the community. We know about their contracts with the local providers or hospitals may or may not be in jeopardy. We know what feedback we're getting as to which carriers may or may not be paying the providers. And so we just sort of walk people through what's available. It's all out there if a client chooses to go it alone. Our value is that working together as a team, we're boots on the ground, if you may. And healthcare is personal, healthcare is local. Kate's very much aware of what's going on in northern New York, whereas Alicia is in Long Island. Neither of them, I think, are as well versed in. I mean, Kate, are you aware of the hospitals and providers in Long Island? Well, not as much as Alicia. Mm-hmm. And you're not going to get that, Steve, through an 800 number. That's why you really want to work with somebody locally who's aware of what's going on. And it doesn't, by the way, doesn't cost the member, the client, anything additional. Our services are the client doesn't pay for that, and it does not affect in any way their premium or their cost sharing. It's just what we do to help folks navigate this, increasingly complex system.
I want to do Michael in Brooklyn. Michael in Brooklyn. He said, I'm very concerned about long-term care. I have not started with Medicare yet, but I'm getting ready to. Will any type of long care help does Medicare actually include?
There you go, Kate. That's your arena.
Yeah.
Yeah, she's got this big smile on her.
Well, it's more of a frown. There really is no such thing as long-term care when you think about Medicare. Okay. When somebody needs long-term care, either in the community and they want to age in place in their home, or in a residential facility, a nursing home, oftentimes Medicaid is what gets triggered. Okay. Here's another trick to remembering the difference. Medicare is because you need care. You're 65 or older, or you've been disabled for 2 years and you've been receiving Social Security disability. You get Medicare after, 2 years. Medicaid, because you need aid. You need financial aid. It is income based. So some folks in our community automatically, because of their budget, because of their income limits, they are eligible for Medicaid. And you have both Medicare and Medicaid at the same time because you need care and you need aid. Those folks are called dual eligible, because you have both Medicare, Medicaid. So when it comes to long-term care, there are often strategic ways to qualify for Medicaid. Even if you're over income, one of the benefits of putting this puzzle together is having resources like elder care lawyers, care managers, where we can put you in touch with those experts to help navigate your individual long-term care need. It's a big conversation.
Exactly.
I can touch upon a lot.
I got to tell you, I'm looking at the questions coming in from TikTok, plus all of our questions from YouTube. There's just not enough time. Tell people, Dan, how they can reach your office.
So our main number is 518-346-2115. Our receptionist can put the caller in touch with Chris, Kate, myself, or one of our agents that's in the caller's local community. Our website is www.dgalcorn.com. And again, you can reach any one of us through the website or through our main number. You can schedule a complimentary telephone consultation direct to any one of our calendars and walk you through, get your questions answered.
Steve, do you see why now I've hooked my wagon to this team?
Oh, absolutely. Hey, that's going to do it for us today. You guys will be back with us again next month. Thank you to TikTok questions. Great questions. I have so many more things to talk about. We'll do it next month. Thank you guys for coming on.
Thank you, Steve.
Great. Thank you.
Right. Have a great day. Thanks all. Bye-bye.
Alcorn and Associates. We're going to go to a break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.